Hi, my name is Nguyen, and I'm currently a P1 pharmacy student at UConn School of Pharmacy.
Hello, my name is Guillermo Grullon, and I'm a P1 student here at the UConn School of Pharmacy.
We are going to be discussing attention deficit hyperactivity disorder, also known as ADHD. We're discussing its symptoms, its diagnosis, and the different treatment options that are available.
Now, what is ADHD? As I mentioned, ADHD is attention deficit hyperactivity disorder, and it is a chronic neurological condition described by continuous hyperactivity and impulsiveness that is disruptive in day-to-day life. It is often more prevalent in children and therefore commonly treated at that level. Although it is a lifelong disease and it can be diagnosed later in life, although this is the rare of the two scenarios, and it leads to an infrequent discussion of ADHD in adults. And the goals of treatment increase decreasing general memory and attentiveness by improving reaction time, improving short-term memory, and the learning of verbal and nonverbal information. Additionally, another goal is reducing hyperactivity through the improvement on-task behaviors, academic performance, and social functioning, and at the same time, an improvement on impulse controls. ADHD can be compared between adults versus children. In adults, there is a lower prevalence due to its difficulty when diagnosing. Just because ADHD can be difficult to diagnose because of a symptom overlap with other mental health disorders. This is particularly seen with bipolar illness, oppositional defiant disorder, learning disorders, and other conditions that ultimately make it hard to discern what condition the patient has, especially since the symptoms between ADHD and many other mental conditions are very similar, again, leading to that overlap, which makes it harder to diagnose a patient. The symptoms may also present themselves differently amongst each patient, which also can create a difficulty when diagnosing. Although diagnosis rates are rising as the education on mental health diseases has been increasing over time. Although it is still underdiagnosed when compared to children. And then in children, there is a higher prevalence, although it is still difficult to diagnose due to the same similar mental health systems as described with adults. The symptoms tend to be mild to moderate in most children, and this does make it a little bit easier to identify in children just because the symptoms can be identified more easily. A child who does have ADHD can be at an increase of risky behaviors and actions in their adolescence just because ADHD does impact their impulse control, leading to them making some of those not as recommended decisions. And the diagnosis rate is also increasing with children just as the world is evolving and learning more about mental conditions. And at the moment, approximately 75% of children undergo some kind of treatment for their ADHD. And now this infographic just shows some common ADHD symptoms, again, looking at children and adults. On the left of the child, you see a child struggling with a task. They're struggling to stay on time. The picture emphasizes how the child also takes additional time compared to a child without the disorder just because they get more distracted, the difficulty sitting still, all taking away from that final completion timeline. And then in adults, this carries over into the real world with longer time completing work-related tasks, becoming easily bored, trouble listening to conversations, focusing during meetings, all aspects of where the symptoms of ADHD are having an interference with their day-to-day life. And then I'm just going to go into some symptoms here. Symptoms can be described into two categories: inattention and hyperactivity and impulsivity. Looking at attention, you can see some trouble paying attention to school, careless errors on assignments and detailed activities, the appearance of not listening when being directly engaged, trouble following organized tasks and instructions, and then difficulty settling down for extended periods of time on certain tasks, and then additionally being easily distracted and forgetful during those tasks. And then looking at hyperactivity and impulsivity, this is the fidgeting, the squirming in the seat, the not being able to sit still, running or climbing in a situation when it's not appropriate, talking or playing too loudly when it's supposed to be quiet, excessive talking, blurting out answers before a question is completely asked, and then trouble waiting for turns and interrupting with others. And these symptoms can lead to childhood issues, being reprimanded more fights in school just because of all these issues leading to be against social norms.
A diagnosis of ADHD is based on the Diagnostic and Statistical Manual of Mental Disorders 5, also known as DSM-5. These criteria are split into two main categories: inattention and hyperactivity/impulsivity. And then there are additional requirements, as signs and symptoms for ADHD may also look like signs and symptoms for other conditions as well. A person does not need to show all the signs and symptoms currently listed to be diagnosed with ADHD. A child needs to exhibit 6 of the symptoms listed, and an adult needs to exhibit 5 per category. It is important to note that while the diagnostic criteria is an important factor in diagnosing ADHD, it is not the only factor. A rating scale may also be used in the diagnosis of ADHD, and a screening test is also given to ensure that the child is not exhibiting symptoms of a different condition. Another important note is that the DSM-5 is not the best way to diagnose adult ADHD, as the guidelines are geared towards children. The bolded signs and symptoms are the most common signs and symptoms exhibited in children with ADHD, but they are not the only ones. ADHD can present itself in a variety of ways. There are 3 common types of ADHD presentation, and they are the combined presentation, the predominantly inattentive presentation, and the predominantly hyperactive impulsive presentation. The predominantly inattentive presentation is when enough symptoms in the inattentive category of the DSM-5 are met, but not enough of the hyperactivity, impulsivity symptoms were met. This type of ADHD usually has problems with focus, concentration, and completing tasks. Some signs of this presentation include difficulty paying attention, often forgetting things, and missing details or failing to do assigned tasks. The predominantly hyperactive impulsive presentation is when enough symptoms in the hyperactivity/impulsivity category of the DSM-5 were met, but not enough of the inattention symptoms were met. This type of ADHD usually involves constant movement, such as fidgeting, and there is difficulty with stopping themselves from engaging in behavior that is disruptive in nature. Some signs of this presentation include frequent fidgeting or tapping of the hands or feet, difficulty waiting for their turn, and general restlessness. The combined presentation is when enough symptoms, at least 6 in children and 5 in adults, of inattention and hyperactivity/impulsivity are met. In the combined presentation, there is difficulty with attention and impulse control. The most common presentation is the predominantly inattentive type. Some statistics on ADHD is that while it is a very common condition with over 6 million people diagnosed, there is still a large number of people who are undiagnosed. In fact, less than 20% of adults with ADHD are currently diagnosed with ADHD and are being treated because of the fact that ADHD has been mainly associated with children and only recently has information and diagnosing tools become available for adults. Almost 2/3 of children with ADHD also have at least one other condition, and most tend to have 2 other conditions alongside ADHD. I will talk about the most common concurrent conditions in a later slide. Around 2 to 8% of college students self-report symptoms of ADHD, and many are diagnosed with ADHD in college. People with ADHD also tend to have other conditions at the same time. Some of the most common conditions are behavioral or conduct problems, which are more common in children. This is because ADHD can make it really hard for children to do things that they find hard or boring, and it's also harder for them to control themselves when they are angry or frustrated, which can lead to behavior problems, especially in children with undiagnosed and untreated ADHD. Another common condition is having a learning disability, which I will talk about in a later slide. Other common conditions are anxiety problems, depression, and being on the autism spectrum disorder. These conditions all affect the ability of a person to function in their daily lives, which is why treatment is very important. However, treatment can be very complex when a person has 2 or more concurrent conditions due to the different adverse effects of the medications, as well as potential interactions between the different medications. It's extremely important to monitor people with concurrent conditions closely when they're put on multiple medications to ensure that the medications are working and that they are not causing any adverse effects. Learning and development is negatively affected by ADHD. However, it is important to note that ADHD itself is not a learning disability. People with ADHD can also have learning disabilities. Learning disabilities do not mean that a person is less intelligent or less capable. It just means that the way that they learn and process information is different, which can make things harder for them when it comes to reading, writing, and doing math. Children with ADHD tend to have difficulty with concentration, communication, memory, and expressing themselves, and so a normal or traditional classroom environment may not be the most conducive to learning. When a child is diagnosed with ADHD, support from the school can be requested, such as accommodations for the child, such as additional time on assignments and exams, assignments being tailored to the child, additional breaks to allow the child to move around, and additional help with organization. There are two approaches that have been taken at schools to help children with ADHD, and they are behavioral classroom management and organizational training. Behavioral classroom management is more of a reward-based system that encourages positive behavior and discourages negative behavior. Organizational training teaches students with ADHD ways to help their time management skills and planning skills and ways to stay organized in order to reduce distractions. Both of these approaches are very helpful but require trained staff to implement them. It's also very important for parents to support their child by advocating for them. Parents should make a plan and play an active role in the management of learning their child's learning and be sure to communicate any concerns they have with the school or provider and ask any questions they may have. Parents should also know what their rights are and what their child's rights are to ensure that the child is getting the appropriate help that they need for their education. These are some additional strategies to help parents with children who have ADHD.
And now we'll talk about some medications for ADHD. Medications for ADHD are split into two categories, stimulant and non-stimulant. And the stimulant is the first line of treatment because they are found to be the most effective. Stimulant medications work by reducing ADHD symptoms by increasing the levels of dopamine in your brain. This is done by slowing down the reabsorption of dopamine. And due to this, more of that neurotransmitter is held in the synapse between neurons long enough for it to properly bind to the receptor. And this helps messages within the brain to be more effectively transmitted and received. And this improves overall activity and communication within those parts of the brain, which operate on dopamine to signal for specific tasks and executive control. Although there is some side effects with stimulants, they can decrease appetite, they can have insomnia, GI stress, irritability, headaches, and growth suppression. And then some common examples of stimulants can be seen through methylphenidate, dextromethylphenidate, lisodexamphetamine or Vyvanse, amphetamine, dextroamphetamine, and Adderall, or mixed amphetamine salts. And then there's non-stimulants. Non-stimulants are not the main choice. Non-stimulants medications target a different neurotransmitter in a similar fashion to stimulants. This neurotransmitter is norepinephrine, and it plays a role in executive function. It aids children in their control of this neurotransmitter and ultimately helps with the control of emotions and completion/initiation of tasks. Non-stimulants, however, as I mentioned, aren't the main form of therapy for children just because they are not always as effective, and therefore many patients will use another form of pharmacological treatment instead, like a stimulant. They do come with some side effects similar to stimulants, but with some slight differences. There's some GI upsetness again, insomnia, a decrease in appetite, although this can be less than experienced with stimulant therapy, dizziness, sedation, hypotension, and headaches. And then some examples of non-stimulants are atomoxetine, clonidine, and guanfacine. And then bupropion is sometimes used, although it is not FDA indicated for this treatment. And then currently, around 30.7% of children don't take medication, and then 69.3% of children do take medication for their ADHD. And this can include other kinds of medications like antidepressants based on the comorbidities of the patient. If someone has anxiety or depression, you'd want to use an antidepressant as a first-line treatment and then medicate with a stimulant after if needed. And then their medications can differ so much because it is a lengthy process of selection. There's lots of trial and error. Some might work for some patients, different dosaging and other forms might work for another. And especially depends on patient, specifically when looking at comorbidities. As I mentioned, each comorbidity will have a different first-line treatment. Bipolar disorders will focus on mood stabilizers first before the ADHD treatment medication first line. And then psychotic disorders will have an antipsychotic first before a stimulant treatment for the ADHD first. Although there are other options for treatment that do not involve medications. And I'll go into those on the next slide. So non-pharmacological treatment can include behavioral therapy, and that is when behavior is modified through principles that are implemented by the parents at home to improve the compliance of parental authoritative commands. This can lead to an increased satisfaction treatment with the patient family and a deeper understanding of the disease overall with the patient, because the family invests more time into the disease, practicing these behavioral modification principles, and then the patient themselves applies these to their life, and the family learns about the disease at the same time. That's one benefit surrounding this medication. There's classroom-based intervention, where a teacher aims to improve the attention, productiveness, and compliance to classroom rules while decreasing disruptive behavior. And this can be done through the inclusion of smaller classrooms, selected seating that is more ideal for the patient's goals, work, and testing modifications / accommodations that are more oriented towards that student. And then just overall education plans that are focused around patients with mental health conditions such as ADHD can help in this kind of therapy. Another kind of therapy can be modeling. And that's when a child is engaged in an activity, but they are shown how to do it step by step at the same time that it is physically described for them. And this allows them to get involved in the process of learning how to do that activity in a way that is expected of them. And that way they can accomplish it correctly. And this can be done with many different behaviors, big or small, so that eventually the child can learn proper mechanisms for navigating throughout life. Mindfulness can be helpful with ADHD for adults and children, because it can calm the mind and strengthen the ability to control one's attention. And then this can then allow you as the patient to learn more about yourself and observe your mental capacity. And then it can help you when you are trying to focus on a set task. And there's physiological treatments. It is said that some physical therapy and physical activity can help reduce the effects of ADHD in a patient, depending on a case-by-case basis. And then there's some dietary interventions that can help a patient, just because some dietary routines can impact ADHD more than others. And so changing up a patient's diet can sometimes have an intervention, although this is not as commonly followed.
Monitoring is really important when treating ADHD because it can help determine whether or not the medication is working and if the medication is safe. As previously mentioned, there's a lot of trial and error when choosing a medication for ADHD treatment, and monitoring is a key part of this process. Monitoring is usually done by teachers and parents, and it usually involves filling out a form such as the ones on the right. The forms help determine whether or not the medication is helping to reduce the symptoms of ADHD and improve functionality in the child or adult. They also help determine whether or not the person receiving treatment is experiencing any adverse reactions to the medication. Monitoring also needs to be done in a variety of settings, such as academic and social, to ensure that the findings are able to help reduce symptoms across the board. It has also been reported that those who had frequent monitoring done during their ADHD treatment had a greater reduction in symptoms than those who did not receive monitoring. Assessment of medication therapy is really important because it also helps determine whether or not the medication is working and whether or not the treatment plan should be changed. The results found in the monitoring stage are useful in the assessment stage to help determine whether or not the medication should be changed. There are separate assessment forms that need to be completed during this stage, and the forms are different depending on the age of the person with ADHD. The forms assess the frequency and severity of the ADHD symptoms, how much their functionality is impaired, and what the impact on their quality of life is. Some common assessment forms for children include the Child Behavior Checklist, or CBCL, which is for children 6 to 18, and rating scales, such as the Connors Rating Scale and the Vanderbilt ADHD Rating Scales. Some common assessment forms for adults include the Adult ADHD Clinical Diagnostic Scale and the Brown ADD Symptoms Assessment Scale for adults. These assessment forms are different from the monitoring forms because instead of a weekly or monthly check, it is done with the past 6 months in mind, and so it is more of an overall assessment. Depending on the results, it may be determined that the medication needs to be changed or adjusted if symptoms are not being reduced and quality and functionality has not improved, or if it has declined. However, it can also show that the medication is working and that no change needs to be made. Thank you for watching our presentation and let us know if you have any questions.